Welcome my YouTube channel. Please like, comment, and subscribe. Maritime head injuries. Working in the maritime industry is inherently risky. If you work in a marina or harbor, aboard a ship, or an offshore oil rig, you do work that is dangerous. There are many different kinds of accidents that can happen, both with and without negligence involved, and a number of different types of injuries to which maritime workers are especially susceptible. One of those is a head injury. Head injuries range from minor to severe and even fatal. If an accident at work causes you to suffer a head injury, know your right and the compensation to which you are entitled under federal maritime law. And then next about types of head injuries. These injuries can be mild with few symptoms and no long-term damage, but they can also be devastating and life-changing. There are several types of head injury that you might suffer on the job in the maritime industry, and these are the most common. Close head injury. This is an injury that does not cause your skull to break or fracture. It may still cause damage, though, including bruising and swelling of the brain. This can be more difficult to diagnose than an open head injury, but have the potential to be just as serious. Open head injury. This type of injury occurs when the skull actually cracks or fractures, or when an object penetrates the skull and brain. It can lead to pressure on the brain as well as bleeding. Concussions. A concussion is the shaking of the brain within the skull. A blow to the head or another part of the body is strong enough can cause the shaking motion that leads to the brain hitting the inside of the skull. Cumulative damage is possible with multiple concussions. Scalp wounds. An injury to your head may lead to a surface wound, bleeding, or infection in the scalp. And then next about head injury complication and treatment. This kind of injuries can cause more damage and complication that is initially obvious. Immediate symptoms include fractures or penetration on the skull, bleeding and wounds, loss of consciousness, vomiting, sleepiness, a stiff neck or headaches, loss of movement in limbs, or abnormal behaviors. Even if there are no symptoms right away, there still may be damage or later complications such as swelling or bleeding in the brain. Treatment for a head injury depends on the severity of the accident and resulting damage. Any blow to the head should be treated regardless of immediate symptoms. Sometimes emergency treatment is necessary. Other possible treatment that may be needed, depending on the situation, include rest and painkillers, blood thinners to prevent blood clotting and seizures, or surgery to relieve pressure on the brain or stop bleeding. Complications of injuries to the head can be serious, but they may not develop right away, which is why it is so important to get immediate treatment, no matter how serious the injury seems to be. Complications can include hematomas, coma, fluid pool up the drain, nerve damage, blood vessel damage, stroke, infection, or cognitive and memory deficiencies. And the next causes of head injury in maritime work. Any busy physical work environment can lead to accidents that cause head injuries. Maritime jobs are especially fraught with risks. Negligence can also play a big part in this kind of injuries. Common causes of in maritime setting include slip and falls caused by obstacles or slippery surfaces, accident moving cargo and equipment accidents. Sometimes these accidents are truly accidental, but many times there is negligence involved. Your employer may be negligent in a head injury case if you or your co-workers were not properly trained to do your job. If you weren't provided with good safety training or safety equipment, if surfaces were not kept clean and obstacle-free, or if equipment was not properly maintained. And then next about what to do if you suffer a head injury at work. The first and most important thing you can do after receiving some types of head injury is to get medical treatment. Even if the injury doesn't seem to be serious, injuries to the head can be deceptive. You may not feel much pain or disorientations, but complications may appear later if you don't get medical attention. Make sure that your medical treatment is well documented so that you can use it to make your case if you are denied compensation later. The next thing to do after you have been cared for is to file an accident report. Your supervisor should complete this report with as much detail about the incident as possible and send it to your employer, the Human Resources Department, and your employer insurer. Thank you for watching this video. Don't forget to give like, comment, and subscribe